Dr. Michael Sapiro, welcome to the show. How you doing?
Good, very good. It's good to be here in your home
Thanks for coming out.
as you leave it.
Yeah, this is the, let it be known, this is the last recording of this episode in this studio. We are moving on up to the west side.
Nice.
Somewhat closer to it, not fully west side, but Beverly Hills. It's gonna be the new home.
Great. Yeah, it's all the same to me. I'm from Idaho. So.
You're from Idaho?
Well, live in Idaho.
You currently live in Idaho?
Yeah, Boise, Idaho.
Well, thanks for coming out.
Yeah, this is good to be here.
Yeah, you've got a new book out and super excited to talk about it because in the zeitgeist now, everybody's talking about psychedelic-assisted psychotherapy, ketamine. I don't know if ketamine is...
Yeah, it's part of what I use.
Is it? Yeah, very interesting. So yeah, let's talk about the potential benefits, the risks, all that stuff because there are a lot of questions, there's a lot of hype. But I figure who better than a Zen Buddhist monk, clinical psychologist to come in and unpack it all for us?
Yes, yeah. I always kind of start any interview I do by letting people know I don't think the medicine's the thing. I don't think it's sexy right now. There's a lot of hype and people are super excited about it. I think it's a tool. I think it's very useful and some of them are very sacred. But I don't think that's what we should be seeking because it's like we're always looking for the how do I feel better quick and how am I going to change forever? It's a lot of fucking work. You're going to put in a lot of work. The experience is a lot of work and the work you do afterward. And so for me, the actual medicine is unconditional love and truth, and that leads to authenticity. And I think that makes the best mental health and a life of thriving. I just wanted to put that in the front.
Yeah, laid out up front.
Yeah.
Well, how did you arrive at this place where this is now your expertise?
I don't know.
Like you've got a very interesting background.
Yeah. I didn't set out to be the psychedelic psychotherapist in my career. I just kept going toward what helps people speak their truth, like find what needs to be said, say it, live it. I did a lot of psychedelics in my youth and in my young middle ages.
You don't present as a clinical, you present as like a rocker.
Well, first of all, I'm a professional musician. So
amazing.
And I also work mostly with first responders. So in the cars, in the trucks, in the engines. And you don't want to appear as a doctor. I don't want to front, Dr. Sapiro, nice to meet you. You know, if I'm on a fire engine or something and we're rolling toward you gotta be real and authentic and be yourself and not present as something. So, I fit really well in that. You know, as a monk, I wouldn't wear my robes and shave my head on and do first responding stuff. So, yeah, I don't present that way.
What is a first responding psychologist do?
It depends on what department I'm working in. So with fire, I'll ride the truck or the engine, and I go on scene with them. We come back to the station and maybe process it. So there's a lot of awful things out there that they're doing and seeing, and so part of my job is just to be with them and be a presence, I guess. And the second part is help them process. Working in the police department, I might do debriefs of really terrible incidents, and so we gather officers together to talk about. I'm also on the crisis negotiation team, so that's hostage negotiation, trained for that, so I'll be on the scene for that, and maybe consulting, making suggestions to the primary negotiator of what they could say to the person who's barricaded or suicidal. And so it's like I just wanted frontline. I wanted to be where life is really rich, and that's usually on the edge of life and death. That's why I like psychedelic work, because that's spiritually on the life of edge and death too. So where people are really kind of alive, where they're losing control. So all of those places are kind of sacred places, I would say. So first responding, they see terrible things, and I like being with them to help process it and make sense of it, make light of it even. And then with psychedelics, and I do a lot of first responding work with psychedelic. So I have police officers and firefighters come to the ketamine clinic. We do a lot of deep dives and help them kind of get their humanity back.
So you are a first responder yourself, but then you also work with first responders.
I guess I would say I'm a poser. I'm not the one doing chest compressions or rescuing people, but I am there on the scene. I don't call myself a first responder because I'm not really doing any of the things that save people, but I'm on that edge and I'm doing my work as a monk or as a psychologist. So it's super interesting and very meaningful to me.
Wow.
just as doing that kind of work in the clinic with people on psychedelics, it's also very, very interesting, fascinating to watch their minds learn new things about themselves and the universe. Yeah, there's a lot we could talk about here. My book actually covers a lot of these different components of my life and work. Yeah,
it's so interesting.
Yeah.
So how did you become interested in psychology?
I think people always came to me from a very young age. I started leading psychedelic groups at 18.
Wow.
With people my age. We'd go out to a forest, and I just had the wherewithal to be present and help them navigate. My mom was a psychologist, is a psychologist, so I kind of grew up seeing her do some really cool work. But really, it's because a lot of people kept coming to me for, are we recording? I mean, like a spiritual guidance, and most of what spiritual guidance is really like, how do I function better? How do I heal what hurts me? And I didn't know how to do that as a meditation teacher, so I got a degree so that I had more tools and understanding of how to work with those things. So it just kind of naturally progressed throughout the years to join all the things together: Buddhism, psychedelic stuff, and psychology.
Wow. So you've always had an interest in plant medicine and its potential to augment the human journey.
Yeah, I had a lot of mystical experiences actually as a 15, 16-year-old, where you kind of see behind the curtain, and then at that age you don't know how to make sense of it or what to do, so you just buck the system because you're like, this is all bullshit.
Wow.
Yeah.
Amazing. When I was 16, I read the Celestine Prophecy, and I felt like that was it for me.
That's a good one.
Yeah.
That's a big one. That could, whatever blows our minds, lets us see behind what is kind of conditioned and what we've been told to believe. I like any of that stuff because it dispels myths that we think we have to live up to. It shows us we're much more than we think we are. So many of us are limited by conditions and patterns and programming that we're kind of stuck in this square, in this cell. So books like that, or the Tao Te Ching, or whatever, if we can get our holds on it and then go, wow, there's something else and more, how do we expand? So definitely psychedelics is a way to do it. And I hope we talk about, like, there's a process, and of course people can just do it, but if they, I think, want the best benefit, for real healing and profound growth, I think there's a structure that works best. That's what I found in my years of doing it.
Yeah. So are there specific conditions that you feel these drugs are best adapted to help treat, or do you think that they're generally, everybody should ultimately have some kind of mind and heart expanding experience with them?
Nothing's good for everybody. So I don't think everybody should do these if there's predisposition to psychosis, schizophrenia, or serious mania, things that are like active suicidality. We don't want people doing that because it destabilizes you, and those conditions are already super destabilizing. Anything like schizophrenia or suicidality, in the moment you're like, I'm not secure and stable. We don't want to give in some kind of agent that kind of fragments even more. So not everyone should be doing this, for sure. I don't think so. But when I started doing this work, I started seeing that depression wasn't what we thought it was. Anxiety is not what we thought. We call them, oh, I'm here for depression. Well, what do you really mean by that? Well, I don't like myself. Well, that we can work with that. I can't work with depression. That's just a cluster of things that, like, I don't sleep well, low self-esteem, poor appetite, low energy. But why? And psychedelic work kind of shows deep inside, well, I was taught I'm not good, or I was taught this, or I was taught this about myself, and I believed it. Well, that we can start working on when you're not defending those very beliefs that hurt you. Most of us defend the things that hurt us. And so in psychedelic work, we
defend the things that hurt us.
Yeah.
What do you mean by that?
Yeah. So if we had a whole group of people here in this room and I asked, what's going on for you? Each one, we would find some beliefs that they have about themselves. I'm like, well, why are you holding on to that belief? Why is that the thing you're carried forward with? Why does that drive you? Because if you just learn, I guess I was taught I'm not good enough, and the only way to be good enough is to produce more or to succeed. And then you learn, oh, I'm good enough as I am. if it was simply learning that, then most of us would just go, oh, I'm better now. But we actually hold on to those beliefs. We think they're important, or, well, my dad or my mom or my teachers told me that. There must be some truth to it. It's really hard to let go of harmful beliefs that we carry about ourselves. Most of my work is helping people see you're being driven by harmful beliefs that you're attached to. And the part of the work is observing it, becoming aware of it, having some kind of compassion, like, oh man, I do think that about myself. And then the next question is like, how do I stop doing that? Because that habit's so strong. All the negative beliefs we have really drive us, and they're like Velcroed.
Wow.
Yeah. So that's part of the work, is like seeing all that and then choosing over and over again, no, I have worth. I'm not a piece of shit. Like, we're attached to our shame and pity. It's really interesting. And you see it when people are in psychedelics, they start to see it themselves, and it becomes clear to themselves, oh, I'm really driven by these beliefs. And then we need to do something about it.
Well, it's fascinating that what you've said is that we don't just cling to them, we fight for them.
We totally protect beliefs that hurt us. Yeah. That's where a lot of our pain comes from.
That's a powerful insight. Man, so when looking at the landscape of tools available to us, psychedelic tools available to us, maybe you can give us like a Cliff's Notes in terms of, because we hear about psilocybin all the time, magic mushrooms, ketamine, MDMA is now being used. Maybe you can sort of paint the landscape for us.
Yeah, we have so many available medicines in the world and toxins in the world, because they can be either one. In my book, I kind of go over MDMA, ketamine, psilocybin, ayahuasca, LSD, and I can't remember. There might have been another one. But I primarily use ketamine at a clinic where it's monitored, and I have nurses on staff who are taking care of our patients, who are watching blood pressure. Ketamine is an anesthetic that was used in surgeries, and they found, people are coming out going, I feel better, and I had some weird experiences while under. And then they started to see there were some mental health benefits. For depression lifted, anxiety reduced, and so they started using it, and now we use it kind of frequently in clinics to help a whole range of things, from trauma, depression, anxiety. Remember, I do air quotes around those things, because when we really discover what they are, there's something much deeper for each one of those.
Now, these are all inpatient treatments, right?
Oh, like you're not in a clinic.
Yeah.
No, home treatment is, I guess I get to say what I think here. It's not always right, but it can lead to addiction. Ketamine home use is usually not awesome for people. They're like, oh, I had a hard day. Let me just let me take some nose spray, or let me dissolve a lozenge in my mouth, and then they get some relief because it's a drug, and they're like, oh, I feel better. And they come home and they're like, oh, I had a really good day. Maybe I should celebrate by using ketamine. I think home use, and it's been shown, it does really increase the potential of addiction. There's very little evidence that doing ketamine at a clinic does that. So I'm a proponent, as is my clinic, for not doing home use for that. Because of those reasons. Ketamine in the clinic, where it's administered and dosed out really well, and we're monitoring blood pressure, we're working with the person, there's a lot of efficacy, great benefit of somebody saying, I'm starting to feel better over time, which is what we want. Why are we looking for a one-time shot? That's just that's not what we're wanting. We want long-term growth or healing. So I always look for what's healing and what's growth. Those are the two things I'm looking for mostly. So MDMA has been shown, of course. You see MAPS work, and it's been shown really, really positive results for PTSD, especially for veterans, and they're still trying to get that in use. I almost agreed with the FDA, we probably do need more research. And do we want people using something that has methamphetamine in it and, without monitoring? And how many clinicians are trained to do that yet? And their protocol is you have two therapists in the room for 6 to 8 hours. That's so expensive for most human beings. They're not going to be able to pay for that kind of treatment. So we still need to figure out what's a more efficient, cost-efficient way for people to be using something like MDMA. MAPS made a good protocol for research, but that doesn't necessarily mean it's good to use like clinically for outside of a research setting. So we gotta do more research on those kinds of things. Again, I don't want to propose that these medicines are what save us. It's the work we're doing of taking care of ourselves, loving ourselves, tending what hurts, and figuring out how to grow. And then each medicine can be used really specifically for different purposes. Yeah.
Yeah. And what are the truths that people typically present to you, in air quotes, that they are trying to unwind?
Yeah. I was innocent as a child. Why was I taught those things? I'm worthy. I'm worthy of love for no reason at all. I don't have to prove it. So people will often go, "Oh, I don't want to be this person anymore. I want to do these things." They might discover they really dislike, like they know they dislike their job, but they might discover why they're staying in their job, why they're attached to staying in their job. They might discover, I'm not really close to my partner, but I'm scared and all the things. And they finally discovering why that is and then how to make changes. I see a lot of people coming out of like religious homes and them feeling really protective of the choices their parents made for them, even though it doesn't work for them. So a lot of people don't want to stay Mormon or Christian or Jewish, and they want to move on and do something that's more meaningful to them, but they're scared to let that go for a lot of reasons. So they might discover a truth that, like, I don't believe in any of that, nor do I want to hold on to it anymore. That's super liberating for a person with any of those medicines to discover those truths in them, because now they can move forward and be more authentic. Most of us really want to be ourselves, but are scared to be. So those are some of the truths I've seen in the work.
Yeah. Why is it always childhood stuff? Like, what is it about childhood trauma or indoctrination? Or it just that leads to such resistance when it comes to rewiring those beliefs or connections.
It's really interesting because a lot of my first responders will come in going, I think I'm going to be processing a pediatric call or something, or I'm going to be processing some things I witnessed out in the field. And almost all the time, it's their own psyches, their own wisdom starts talking about their grandparents, their mother, their father. I don't do that. I wait for them. But mostly in these sessions, all of a sudden, there's talking about their upbringing and how they were raised and the things that were put onto them, the stresses. All of us, every single human being is programmed from even before birth through our parents, how we experience the world. And so specifically in childhood, we're literally being programmed to see the world certain ways through our parents or caregivers or society's lenses. And that's baked into our personalities. And then we grow up and we're like, something's off here. I don't feel like myself. I don't feel comfortable in my body. I don't even hold these beliefs to be true. And so most of the time when I trace what someone brings into me, when I'm following the thread, it is usually comes back to, how old were you when that started? Oh, I was 8, I was 6, I was 12. And then we start doing the work around that period of their life. Mm-hmm.
Yeah, it's crazy how even the smallest thing when you're a little kid can, reverberate throughout time and have an impact well into adulthood.
All of us, if we stopped and every person who's listening, I say, what are you struggling with right now? And where did the way you're struggling with it start? Do you hear the question? Is not like, what are you struggling with? Is what is the way you're struggling with it? Where did that start? So I had a firefighter, and this is in the book. He overworked, 80, 90 hours a week for 20 years. That's a lot of work.
Yeah.
So he did his 48-hour shift, and then he would work possibly 50 hours or 40 hours after that. And drank a lot, and we started to trace. And I love this story. This is in ketamine session. We started to trace where did you start feeling bad about yourself? Because he recognized, I'm overworking to compensate. I'm overworking because I have to prove myself. Okay, well, where did that start? Well, he thought maybe it started in his teenage years, breaking away from the religious family, but that wasn't quite it. So we kept looking, and he goes, I was in 7th grade, and I was sitting at my desk, and this girl who I really like next to me I'm going to paraphrase, basically turned toward me, and she was like, you're really ugly, and no one is going to love you.
Wow.
And he said that remembering that was like a gut punch. And he's like, I remember that moment. And she went on, she goes, no matter how much you try, no one's really going to love you. And oh man, it's fucking heartbreaking. And he's like, I held on to that for so long of my life that when I was in a bad marriage and I wanted to get out, I kept thinking deep inside, no one else is going to love me, so I might as well stay in this relationship. This is often what we see in psychedelic work, those kinds of revelations that our hearts are waiting to express, but we are numbing or we're avoiding or we're denying. And he was so mind blown when he realized he's still holding on to it. He's like 47-year-old dude, still wondering, am I lovable? Because of that one moment in his history that tainted things. We all have something like that. It doesn't have to be I was beaten by my parents and that really messed me up. It can be just messages like that we receive that stick with us, and now we're overworking or we're drinking or we're staying in bad relationships. And all of this starts being exposed while we're under medicine, because you can speak your truth. That's why I call the book Truth Medicine. The work I do is like helping people access that and speak about it. Yeah.
Man. Mm-hmm. And so what is it about a compound like ketamine that allows us to open the doors of perception so as to see and express these connections?
Well, I can't speak of the pharmacological aspects of it. That's outside the scope. So when we ask, what are the mechanisms? We look at each of these drugs and we look at the neuroscience behind them. So what in the brains, we have different ways of looking at how medicine interacts with us. So there's neuroscience. How does the brain and this chemical interact? What is it doing? Then there's psychological. What is it doing to enhance our ability to see ourselves more clearly or to have more creativity or potential come out? What does it do spiritually? And so when I speak with neuroscientists, because I'm not one, and I'm like, what's it doing in the brain? My favorite neuroscientists actually go, well, we can tell you kind of what we think it does and what the scans are showing. But my favorite neuroscientists, and I wrote this in the book too, are like, it doesn't really matter for us. It matters the subjective experience of the person. What do they think it's doing to them and their perception of themselves? That's where I'm most excited about, because I'm like, this medicine gives us a perception of ourselves that we normally don't have. It helps us step back a little bit, become aware of ourselves in a whole new way. We might say it dissolves or it lessens the whole of the ego, a structure and a part of us that kind of dominates us and has us see things a certain way that either protects us. And it seems to loosen the hold on what we know as the default mode network, kind of way the brain is operating in a normal day-to-day way. It disrupts that. So we're seeing and experiencing reality completely different. That's, I think, the best benefit of these medicines, is it distorts our normal way of seeing the world so that we have more access to what I call the psyche, which is everything deep within us, and the cosmos, which could be the universe presenting itself in symbols and signs, things that we might right in this very moment have access to, but usually push away or we're not paying attention to. So the drugs allow us to see so much more of reality, ourselves and the universe around us.
Yeah, I remember when the late, great Roland Griffiths would talk about how the vastness of the experience was correlated to the size of the effect.
Yes.
And how patients that were that would report experiences of awe and wonder would the greater the experience of awe and wonder, the more benefit they seem to derive from the experience.
Sure. First of all, many of us lack joy, awe, and wonder just in general. We're working We're working hard. We're raising our kids. We're distracted by our own negativity or by this flipping phone shit we've got going on that distracts us from the beauty of the moment. What mystics talk about throughout history of religion or spirituality is that people who are really present in the moment often experience awe and wonder. They're literally stopping to smell the roses, not metaphorically. They're taking a walk and they're like, oh, I can smell the jasmine. I can smell roses. I can smell anything around me. And that brings me a sense of, wow, this is a full, rich life in this very moment. So there's something about having that accessible to us, and the medicines tend to give us that, as do meditation, drumming, dancing practices. When you're really committed to those, it wakes us up to the vibrancy of life in our own body. So awe and wonder brings that to us. I call that ordinary mysticism. These medicines give us a sense of ordinary mysticism. A lot of my veterans after retreats, and I write about this in the book too, they'll text me pictures of colorful mailboxes or snow on a fence. And they're like, look at this. Look at how the snow sits on a fence. Now you might go, you sound high, bro. But the truth is they're experiencing life in a richness again, because they were completely dulled. And now they experience vibrancy. That's one of the ways the medicines bring us awe and wonder. Another is it connects us to the greater scene of life, and we don't feel alone. So what Roland Griffiths talked about was a sense of belonging. When we have a vaster experience of the universe, we feel like we belong to it. We're not just isolated in a meat suit trying to hurry up to work and take care of the kids. We're like, oh, I'm part of the grandeur of things. And it gives more meaning to the things that seem mundane. So now taking care of the kids is taking care of a part of the universe. It shifts our sense of belonging to this greater thing, which actually makes us feel better. So that's another way that these medicines operate.
What did you ordinary
mysticism?
I love that term. Is there a way to reverse engineer your clinical, practice utilizing ketamine to be able to deploy ordinary mysticism in our day-to-days if we're not yet at the stage ready to leap into these more intensive therapies?
Yeah. I think I have a whole chapter on it. I say you don't even have to do psychedelics to do this, but I would recommend one thing, which is, like I said, spend some time on your phone scrolling, like a lot of people do, and feel your body. Actually feel your body, the sensations of your body. And now go outside and go to a river or sit by a tree or sit in a garden or just listen. We have so many birds around right now. And then hear them or feel or sense your environment, and then sense your body. There's a complete difference when we're contracting into a small experience that is just cerebral on our phones or something versus like we're expanding our senses to be with nature. It's a visceral difference. You don't have to take drugs to feel the vibrancy of one and the constriction and numbness of the other. So what if more of us would, a lot of my treatment for people not taking psychedelics is, can you slow down for 10 minutes today? Here's a meditation, or I'm going to ask you to, after you're done today with like therapy, go just sit on my front porch and just listen to life happening for 10 minutes before you go back to wherever you're doing. And they often report, I feel more at ease, I feel more at peace. And then those who make that a more lasting part of their life, they're doing 10 minutes, 20 minutes of sitting still and listening to things. The wellness reports skyrocket.
Wow.
Just the birds alone, you can feel a sense of ease and like, okay, I'm not as cluttered as I was when I was on my phone or rushing.
Yeah.
Yeah.
Wow. I feel like that kind of mysticism is something that I'm regularly able to access, not maybe to the degree that I would like to be able to access it, because I'm still prone to doom scrolling way more than I'd like so many of us are these days. But yeah, I feel like I routinely have moments of awareness about my surroundings and like the residues of experiences that I have can stay with me sometimes for days. Before we got rolling, I was telling you about, I just this weekend watched the new Pee Wee Herman documentary, Pee Wee as himself. It's still like, it's resonated with me in a way that I never thought it was going to. I was like, oh, here's a documentary about this character I used to love in my childhood, and I can't stop thinking about it. But it's also, it can also be like, and I love that. Like, I love that I'm so sensitive and tapped into that and open to being able to have that kind of communion with art,
with life. Yeah, and you were using words like resonance. That's in the body. It's felt. I mean, resonance is not a thought. It's an experience. Vibrations of sound resonate. Feelings resonate. You're thinking about the documentary. You're not just thinking, you're feeling something about it. That's why it's staying with you more than likely. Every time you think of it, you feel something in your body. I
cried my eyes out at the end.
That's beautiful. Yeah. That is so powerful. Most of what I ask people to do is feel. Like, stop talking and feel that for a moment. I go, and they get quiet, and then the body has a total visceral response to whatever they're thinking or a memory, and they feel it. Grief is felt. It's not an idea. Nothing I want to do is theoretical in my work. Everybody who works with me gets to have a raw experience, which is where healing and growth actually are felt. And so when you're talking about that, you feel it, and it takes awareness to know you're feeling. So that's a big part of what we're talking about, is like presence and paying attention are actually some of the most strongest medicines we have for healing, is paying attention and awareness and then tuning into our bodies.
Can it ever be a double-edged sword in the sense that, as sensitive as I am to pleasurable experiences, like, I can also be prone to I'm also sensitive to negative experiences. Of course. It's one of the reasons why I was so happy to move out of New York City, which is where I grew up, because the din of the city, the air pollution, the noise, I felt that in a way that, like, I would look around at other people walking around, like, on the sidewalk, and I'd be like, am I the only one that's like, that can't believe that people have just, consented to living in this madness?
No, you don't get out of feeling. Feeling is feeling, and it comes with all kinds of sensations and all kinds of emotions. People often come and they're like, I am so ready for joy. I'm great. Are you ready for sadness? No, Dr. Mike. I said, I want joy. I'm
Only
like,
joy.
Sorry, dude. Like, you can't have just positive experience. You have to open yourself to everything. And that is difficult for so many of us when we've compartmentalized or numbed through drugs, alcohol, sex, shopping, whatever it is, distancing ourselves from painful things. You can't have positive. It doesn't work that way. I'm sorry to tell anyone listening, it just doesn't work that way. You widen your ability to feel, and it comes with all the feels, and you learn to welcome them, tolerate them, even honor them. And then when it's painful, like grief or anger, you tend to it. And when it's positive, what we call more positive, joy, awe, you experience it, but without attachment to I want more of that. You just experience it. And then all of a sudden you're experiencing life. It's like people just want one flavor of goodness, but they have to have all of it. And then life becomes delicious again in its pain, in its sorrow and grief. There's then also joy and wonder and awe arise, sometimes simultaneously. We can't push anything away.
For somebody listening to this, watching this, who feels as though they've become numb to the awe and wonder of their day-to-day lives, how would you shake them out of it?
I'd ask them if they want to, and then are they able to tolerate and start talking about things that hurt? And simultaneously, what that often does is bring, relief. Like for me, it seems like there's relief in the middle of all the painful things we're trying to avoid. So people who often come saying, I'm ready to thrive or have joy or be bright again, I often ask, how much are you pushing away things you don't like? And I'm telling you, almost every single person's like, I don't want those things. Well, you don't get a choice. You have to do all. So my question is, are you willing to sit with things that are painful, really sit with and tend to them, take care of them? You see I'm putting my hands on my belly and heart because it's like Mikey didn't get this when he needed it from his parents, so I'm doing it for him. And so it's like there's lots of steps and stages to doing this. And all of a sudden we're like, okay, I've tended to myself. And now there's a richness that I'm also getting, like, wow, that sunset today was really vibrant. Because you felt the grief you needed to feel. So many people are dulled. I've been dulled. It's not just, I'm not saying it's not me. I'm saying all of us have been dulled and numb what we don't want to feel. So part of this experience of psychedelic psychotherapy is truly allowing in all of it, with grace and patience and understanding why we're feeling those things.
How does psychedelic-assisted psychotherapy differ from EMDR? EMDR, I've heard of that. I have friends that swear by it. I've actually tried it, and I don't have extensive experience with it, but I've tried it. I don't know if I was as open to receiving the benefits from it or whatever. But yeah, it's something that comes up a lot.
Again, nothing works for everybody. So some person might really benefit from EMDR, another might benefit from ketamine-assisted psychotherapy. And maybe in a little bit I can explain like what I actually do in real time. What is the psychotherapeutic part of my work? Because in the field there's a lot of people who are sitting with or guiding or just supporting. I'm actually doing psychotherapy while they're on the substance. So it's a little bit of a different nuance that I'm doing.
What does that look like?
But I'll tell you in one sec. But I did want to go back to your other question. The reason I'm such a proponent for psychedelic psychotherapy is because they're having an experience that in real time the healing happens in real time in psychedelic experiences because they're literally feeling and EMDR can help elicit those feelings too. It's not like no other therapy we've ever used can elicit feelings that you have to work on. But we're not talking. We're actually leading them to a full-bodied experience where at that moment they're having a full-bodied experience because it's not intellectual. When you're on a psychedelic, it's depending on the dose. For sure, you're not having an intellectual experience. I'm not going to ask you right now, can you picture a time in your childhood you had this trouble and you're picturing it, you might have some feelings going on. That can be helpful. They're actually like really there. They're really seeing that child or they are that child. And it's like they're having a real-time experience on the psychedelic. That then we get to apply compassion, love, tenderness, nurturance in real time to the part of them that's truly having that experience. We're all talk therapy. Most talk therapy, we are eliciting some kind of experience, but it's still somewhat cognitive and intellectual. So I want them in a full-bodied experience.
It sounds like, I mean, if I can reduce and simplify it sounds like you're exposing the inner child and giving it a hug.
100%. The inner child, we would say, is actually showing up. And it's not theoretical. It's the smell of a rose. It's the taste of a meal. It's the essence of that child showing up. We can get to that other ways. I could probably even just right here help you feel that too. But there's a part of you that possibly could be defensive or don't want to do it. And then,
I'll play guinea pig. Yeah.
No, I'm saying we don't need the psychedelic to do it, but it makes it immediately accessible more than not.
Got it. That makes sense.
Yeah, so that's why it's such a powerful method, is because it's an almost immediate experience rather than a theoretical one.
Right.
I want people out of their heads. We spend too much time there, and the psychedelic really takes them out of their heads.
Well, that's why I think I didn't really get much from EMDR, because I was intellectualising the experience, and I was, everything I was saying, because it was like a verbal exchange with my therapist, was just, it was all coming through my ego.
And there are therapists who could work with you and get you to the gut punch. In Zen, there's the Rinzai Zen tradition. They actually slap you awake.
Really?
Yeah, it's to really startle you out of your default mode network and go, whoa. Good therapists can do that with any modality. I'm always trying for the gut punch. I want the most direct, raw experience where someone's viscerally feeling the thing, because that's where we can then go tend to it. It's exposing the actual wound rather than talking about the wound.
Wow.
Yeah.
Yeah. So walk me through what your what your approach actually looks like tactically.
Intake and prep are just as important as everything else. So intake means we're checking in with their medical and psychiatric history. Is this medicine good for you? Will it hurt you, or could it benefit you? Are you basically okay to take this medicine? So a good screening is protective, and it looks for safety. Am I the right person for you? I might not be. I'm super direct. I work with combat vets, SWAT operators, firefighters. I'm so direct. Not everyone likes that approach, and I understand. So you might come to me in an intake screening and go, oh, I don't like this dude. I'm like, God bless you. It's okay. I don't like this dude sometimes too. So we're assessing, hey, are we cool here? Do you trust me at all to sit with me and be vulnerable? After good screening and intake process where they know what their rights are, they can say no until they take the medicine. Someone does not have to say yes until you take the medicine. Then it's like, well, you just took it, so you're not getting out of it. And then we do prep work, and that can be one session to a couple months of prep work. And prep work, I call it discovering the heart of the hurt. I'm hearing what they're really saying in the inside. I'm doing some psychological surgery, finding the threads to their deepest pain, because that's what generally is going to show up in session.
Ooh, the heart of the hurt.
The heart of the hurt.
Damn.
You come and you're like, I want to stop drinking. Why? Okay, why'd you start drinking? Well, and then we start getting toward that moment that hurt the worst, and they started numbing themselves. I want to touch that in prep sessions, because more than likely that's coming out in session on ketamine or whatever medicine they're using. And so I spend some time touching those things, helping them talk about it, verbalize it, feel it in real time, even in prep work. Prep work also talks about, how are you going to face the unknown? You might be stripped of control in there. How are you going to face surrendering when you want to hold tight? What are you going to do if you might flip out? Do you want to learn some breathing techniques? Do you want to learn how to, step out of the experience and then tend to yourself? Or do you want to stay in the experience and just navigate the difficulties? So we're prepping for that. Sometimes I have them do meditations where we're imagining laying on a stream with your eyes closed and letting the water take you where it will. That is hard for many people with trauma. They don't want to give up control, close their eyes, and float down a stream. So I'm literally training them to be in the medicine session, you're going to be stripped of a lot of control. Can we prep you for that? That's part of the prep process too. Look like you're thinking. Any questions?
No, yeah. It's I think it's it's important that you're selecting for the right patient, that you're adequately preparing them. This all sounds like very important due diligence.
It is, and it's teaching them how to be in their lives differently. One, how do you just speak what you need to say? I wasn't treated well, and it hurt, and here's what it's left me doing in my life. Most people, I want them to say that as soon as they can, so they recognize, I was hurt, and I'm carrying on that hurt, and it's influencing the way I see people, I see myself. And then so many of us are not good with mystery and the unknown. But we thrive in it. That's the irony. We close off spontaneity and fluidity. We close off mystery because we want to feel safe. I get it. But then it's like you don't get to experience the vastness of the universe if you're staying in a very small box. We do that to stay safe, but psychedelics blow you out of that box. So I'm going to prep people to have a relationship with the mystery of life.
Wow.
So they're not so scared, and that translates to their regular waking life. Maybe I'll try new things. Maybe I will take that trip I was scared to, but I want to now. Everything's practical here. I want to make it so that they're living full and rich lives. If I can do that in prep sessions, I will spend time doing that. That's therapeutic just in itself.
Yeah.
So that and then I teach something called cost, curiosity, openness, surrender, and trust. They take those words home and think about it, because while they're on medicine, that's what I ask them to do. Can you be curious about what's coming up for you? Can you be open to it? Can you surrender to it? And then do you trust it? People with trauma are like, fuck that. Scary. But what good training. And then we get to the medicine sessions. 1 to 6 times, depending on the medicine. Ketamine, we can do up to 6. If there are other medicines, we might just do a one-time deal, 6 hours, 7 hours that for a day. And so depending on the medicine and dose, I will be working with them therapeutically. They'll have space and time to explore their psyches and the cosmos and psychedelic stuff like planets and dragons and asteroids or whatever comes up for them, or memories. And on ketamine, we'll have the right dose where we're talking back and forth to each other. And I'm asking them, what's your experience like? Can you follow that? Can you explore that? Maybe a memory comes up. Can you talk to that part of you? If the dose is too high, they can't retain a question. So I just let them have their experience and check in once in a while. So dose is really important to do psychotherapy.
How verbal are they during the treatment?
A lot of, I take journey notes so that they remember what they're saying so they can look at the end. Most of them are always talking.
Wow.
Yeah. Mm-hmm. Now, there is time for quiet and exploration. The difference between psychedelic-assisted therapy and psychedelic-assisted psychotherapy is I'm actually doing psychotherapy with them while they're on medicine.
What is the difference? I've never,
Yeah. So there's ketamine-assisted therapy, and then there's CAP, ketamine-assisted psychotherapy. Most psychedelic therapies up till now are generally people leaving lots of space for the person inside themselves. They have shades on and maybe music, headphones or something, and they might check in. How's your experience? How are you doing? Do you want to talk about anything? And then give them a lot of space to do their inside work. And I think that's valuable too. I'm not saying that's a bad technique or anything. But so many of us have skill sets that we can use. I've been trained to work with people while they're in altered states of consciousness. I've been trained, and I have lots of experience of talking with them and having them verbalize to me, what is it like for you now? What are you experiencing? And they'll tell me, and then we'll use that to go toward one of their healing goals. So they want to touch their innocence before the trauma happens. So I might lead them sometimes, or I might be more direct than other therapies, which are non-directive. They just let the person experience it. We have agreed to talk back and forth while they're on the medicine about their experiences. So one woman in the book I wrote about had a brain tumor, and she was dying, and she came to me to make peace with her death and let go of control she was having over her husband, basically, to how to parent after she left, and it was causing a lot of friction between them. And during the session, she was trying to control her experience, and I kept asking, isn't this what your normal waking life is? And she's like, yes, this is what I do. I control everybody and everything. So I said, what would it be like to give that up and let yourself be taken by the experience rather than controlling it? And she decided to do that, because you can decide not to do that. And then she started having floods of images that were blocked beforehand, because she was trying to produce images rather than be open to images. Then she started seeing all these things from her life that she had not resolved or that she wanted to remember. And then we started talking about each one of those people or memories, about what that meant to her. Was there anything she needed to repair? Was there anything she wanted to let go of or remember and hold dear? And so we were able to really penetrate the depth of her psyche that she was stopping. So partly my job is to encourage, hey, dude, you came here for this specific thing and you're kind of not doing that. Do you want some help? And so I would actually I'm much more direct. The field isn't doing a ton of this right now. I'm training people to do it, therapists who want to do more of this approach.
The more direct approach.
The more direct approach. I have a skill set. I'm going to use it.
Yeah.
But it's still led by their hearts, and their wisdom brings up what they want to talk about, but I'm going to be working with them that way. If the dose is too high, they'll be too kind of caught in the psychedelia, the psychedelic experience, and I'm not going to do psychotherapy. I'm going to step out of that role and just let them have their experience, and I might check in, see how they're doing, and wait for the dose to kind of diminish within them, and then we'll start processing. So I have to be willing to kind of work wherever they're at consciously with the medicine. That's why dose is important.
Do you dose based on weight, or is it based on some
psychological
metric?
All of it. What's your experience? Have you had this? Have you done psychedelics before? No. Okay, we might do a lower dose. At the clinic, we're very conscientious about dosing by weight and by prior experience in non-altered states. So somebody who comes going, hey, dude, I've tripped for years. We're like, okay, we can start you on higher doses. You know how to navigate. With ketamine, it's too much of a dissociative. If you give too high of a dose, they're out. And it's
K-hole.
Yeah, they could get into
the
proverbial K-hole, which it can be very therapeutic and very enriching or very scary, depending on their relationship to the K-hole. It's always our relationship to the experience I'm looking at. Are you freaking out now? Is that what you normally do when you're scared? Are you fighting now? Is that what you normally do when you're scared or when you're uncomfortable? That's so much data for us to use. How they're engaging is really important data, because that teaches me how they mostly engage with their normal waking lives. Now, of course, if they're in a K-hole, I'm just sitting next to them and they're like, oh, I'm not even here. I think I've died. And I'll be like, well, die then. Die then. Let it all go. Some people have gotten, very scared in those places, and I'll hold their arm or their hand and, reassure them, you're here, I'm here. What's going on? Oh, you're totally dissolving. It's okay, and I drop deep into presence and just become a soothing person. I'm not a therapist. I'm a mother or a father for them in that moment.
Wow.
Yeah.
And you said it lasts typically anywhere between 1 to 6 hours?
Well, it depends on the medicine. MDMA could last up to 6, psilocybin, depending on dose, 3 to 6 hours. Ketamine, we're administering by IV, so we have a machine that times it. Or an IM, an injection, can go up to 45 minutes. So it depends on dose and medicine. Mm-hmm.
Wow. You get a bathroom break?
So I need to take them sometimes. They do too, of course, depending on the length of the thing. And that can be an interesting experience. If it's at the clinic and they need to go to the bathroom, a nurse will come in and help them right there. I usually step out, of course, and give them privacy, or they'll walk to the bathroom. If it's a private experience, they'll be walked to the bathroom. And
wow.
My role is caretaker, referee, safety, and therapist. I'll switch depending on what's really called for and where they're at in their experience.
And then after the session, what do you typically see?
Well, there's right away, there's like, you're going to go home and I'd like you, here's some things to do and some things not to do. Don't over-explain yourself to anybody. Don't try to explain this. Really, you can say, hey, I'm not ready to talk about it. Let's say your spouse or friend is super curious. You're like, I'm going to wait till tomorrow to tell you more. Good food, cleaning themselves, resting. And then next day I ask them to read the notes I've taken and then to journal. And we have tons of prompts. I've always given them tons of prompts before they go to the session, and they have a lot of prompts after the session. And this starts what we know in the field as integration. The integration starts during prep. We're going to prep you to know what to do afterward. These are things I want you to think about, set up. Do you have friends and community? Do you have therapists? Because this is it could open so much for you. Do you have an ecosystem of support in place? That's prep work. So when they go home, it starts the rest of their lives. What do they want different? So I'll usually see them 1 to 3 sessions for integration, or a few months if they stay with me. And we start discovering what they learned in their session or sessions and start making practices out of those. So you learned that you talked to yourself really poorly. What would being aware of that habit look like? What would journaling about it look like? What would then start giving yourself grace look like? That might be their assignment for a month. A month of your life, you're going to catch how bad you talk to yourself. You're going to stop it, apologize, give yourself grace, and go, it's okay for me to mess up. That's a practice that they are going to take with them, because they learned in session, let's say they go, wow, I am really hard on myself and I don't need to be. So we'll push that forward into their next few months of their life, where they can practice these new skills. And all of a sudden, not all of a sudden, but all of a sudden they're talking to themselves kindlier, with more grace and patience. That can become a sustained way of being for the rest of their life.
Wow.
Yeah. So it's not just the medicine day, it's the whole thing that helps them shift.
Incredible.
Yeah.
Man, it sounds so valuable, especially today in light of like the mental health statistics that you routinely hear, that we're in the midst of a mental health, like an epidemic of mental disease.
Discomfort, disorientation. We're so disoriented toward ourselves, what we want, what we know to be true versus what we're doing.
Yeah.
It's very uncomfortable to be human right now.
It is. Yeah.
This is super valuable, this experience, this process.
Uh-huh.
Yeah.
This is a related, but I guess tangential question. A lot of women have like sexual trauma. Are you the right man for that job, or I don't know. I mean,
depends, might not. It may be, and I might not be. That's something we can discover in prep work. So many women have been assaulted or molested or just objectified, and their relationship to their body changes based on all of that. Relationship to themselves and other men changes on that. I've had some experiences where I've not been the right person, because I'm very direct, and oftentimes could be too direct, and that can be not what's needed. A softer, more gentler approach.
Yeah, you have very masculine energy.
Sometimes, yeah. Well, that's been formed more. I work in the field of first responding. I think I've shifted somewhat to just being like, let's just get to the point and do this work. I can be nurturing and soft and gentle, but I'm like, we only have so much time together and in your life. I've dudes who have sexual trauma in their lives. Surprising amount of them, especially in the military field, actually.
That's interesting.
But no, I'm not right for everybody, and I would refer and I would say, hey, something's off here. We might talk about it and process it. Other times I am the right person for it, because they need my energy or insight, and then we have a trust, because I have many clients, many women clients, many of them have sexual abuse in their history, and I am the one helping work them through that.
Amazing.
Other times I'm not.
Yeah, no, your energy is not purely masculine. I mean, it's you do have a very warm, nurturing. Yeah, no, it's
You're
incredible.
Just saying that now.
No, I think it's I mean, yeah, we all have trauma, and I've dabbled in psychedelic medicine recreationally, irresponsibly at times, but I know that those experiences are valuable for me, or have been for me, because they do allow access to different parts of my psyche that are not typically in the day-to-day, when you're trapped in the quotidian day-to-day, going from point A to point B, aren't always as easily accessible. And so, I definitely can see the value.
So in my book, I describe there's recreation, the types of uses that I've seen over my lifetime, but there's recreational use, like we're talking about, for fun and parties, and also just going to the forest with your friends is recreational. that can involve a lot of laughter and giddy stuff. You could freak out also and have a terrible experience and have to learn that way too. There's ceremonial use as done throughout all of history, and that can involve shamanistic or ritualistic kind of practices like drumming and dancing and singing and prayer, and then taking the medicine and being guided or held by a community or a medicine person. And those are specific to looking sometimes at ancestors or dreams. Ceremony uses are also for like diseases and disorders, that they would use ceremonies to determine what's going on in the physical body as well as the energetic or spiritual body. These are more ceremonial uses. Then we have different kinds of therapeutic uses, like in research, and let's say you're sitting for a friend who trusts you, and you're sitting there. That's kind of therapeutic. You're there for a best friend who's having their experience. You're not doing therapy with them, but it is a therapeutic kind of intention. And then there's psychotherapeutic, where I'm sitting doing psychotherapy. I don't lead ceremony because I'm not trained in that, and I'm not a shaman or a medicine person in that sense. I've done all the other ones though. You know, I've been a part of ceremonial, but I don't lead those. And I think that takes a lot of years and apprenticeship to get to that place to do that. Although in some way, I do work with the cosmos and the psyche because that's what's presenting itself in session. It's hard not to like go, oh, this is a cosmic thing coming in. Oh, this is a psychic thing coming in. So we do have to have some experience as therapists to hold those things as they arise in session.
Yeah.
Yeah.
No, I mean, there's definitely, I feel like obviously you're an expert and you have all this incredible training under your belt, but also as you were saying, like when a friend just sitting beside another and providing a therapeutic, holding a therapeutic space for them, I do feel like, and I'd be curious to know if you agree, that there is sort of this innate knowing in each of us how to provide therapy to one another. I mean, like when my cat comes and sits on my chest and starts purring. I mean, well, I don't know if there's data, but some have said that there's like a frequency, right? Like that
for sure.
That pets are healing cats. You know, the cat purrs at a frequency that's like profoundly healing. She doesn't know that she's doing that, but there is this sort of communion.
Oh, they might know. I mean, if you're upset, your pet might come to you because they're feeling you. I think have the innate ability to nurture, to tend, and what you're talking about is presencing. If you decide your friend needs some help, or they ask you, hey, Max, could you just hang out with me? I'm going to do this thing. I trust you. And you do nothing but be present for them, and you're sitting, you're watching them. Maybe you give tissues or some water, or maybe they throw up and you help them throw up. That's innately healing, to be held by another person. I think our presence is one of the most precious gifts we give each other. The best thing a parent can do with a child who's hurting is slow themselves down and simply be present first and foremost, because that vibrates at a certain level versus like problem solving or getting angry at the thing. So you just being present for another person, much of what I teach my students is how to presence. Not all my students are therapists, like psychotherapists. Many are coaches or they're sitters. And I teach them how to be present with, because that alone is what facilitates healing just on its own level. Exactly like what you're saying.
Incredible. What would you say the biggest misconceptions are today about psychedelic-assisted psychotherapy, ketamine-assisted psychotherapy?
That it's going to heal everything for you, that it's a magic bullet, that you have ego dissolution, that you'll meet God. Those things all can happen, but I don't want them to be the focus. That you're going to have a one and done thing. You're going to feel a lot better when you're done, and you're going to have a change that's sustained. Generally, that's not how it works. People should know this is hard work, just like anything. Antidepressants don't work long-term either. They were not the magic bullet either, and we thought they might be. And so I don't want us to think psychedelics in the same way, but these are different. They're natural, so they're going to help heal us. Well, so would an apple then, like that. nothing's going to heal us but the work we put into our healing or into ourselves. So the misconception that you're going to have an ego, I have a lot of people coming in expecting ego dissolutions, ego deaths. And then when it starts happening, they freak the F out. And you're like, well, you asked for this, first of all. And it's not what you think it is. It's not what you think it is. Your ego's wanting something it heard about. And I often say, if you're going to try medicines, actually talk to someone you trust about it, but don't just YouTube it. There's so much misinformation and misguidance out there. People come to me with really harmful expectations. And what happens when they have expectations of me, the medicine, or themselves? It's the same as they have expectations out in the real world. They end up feeling disappointed or like they failed, or they're resentful of the process or the medicine. So I do a really thorough job in the beginning of helping dismantling expectations, because the media is just creating so many expectations that are unrealistic. So I have to undo that when people come to me a lot.
Well, they are sometimes thought of, in pop culture at least, as a shortcut of sorts. Would you say that's
yeah, sure,
accurate?
hack. Yeah, it's a shortcut, but to what? And then no one wants to put in the work after. I'm a traditionalist. I spent almost 30 years in meditation training, and I'm still got stuff. We all have stuff. It's an ongoing, unfolding process. And I think the shortcut is to seeing something new, to experiencing something new. For sure, you're going to get in the new experience, most likely. But how is that going to sustain itself? The brain doesn't work that way. It needs repetition of a new idea, concept, or practice to have sustained change. So we can't have any shortcuts, really. The only shortcuts we've found are near-death experiences, car crashes, divorces, things that really wake you up. You're like, oh, God, I didn't know what I didn't know. Or those things tend to have long-lasting impacts. A shortcut through a psychedelic just shows you what's possible. Now you got to do the work.
Yeah, you do have to do the work. Well, I'm super excited for your book, Truth Medicine. I think it's really important, and we've covered this topic a little bit on the show in the past, and I think it's, especially today, it's of crucial importance. But I just know how difficult these kinds of struggles can be. We've talked in the past to Michael Pollan. We've had Robin Carhart Harris on the show, and yeah, he's incredible.
Yeah, he's the one I was talking about. One of the neuroscientists I enjoy, and
oh wow,
he very much appreciates the subjective experience of the person, even over the data. Sometimes he finds that's what I had to learn from him.
Well, yeah, you have to be evidence-based, but not evidence-bound.
Yeah, exactly.
That's my philosophy. Well, thank you so much for coming in and sharing your wisdom with us. And I've got one last question for you before we get to that. Where can people pick up your book, and where can they connect with you on social media? Oh, yeah. I really hope today was somewhat insightful or new for people listening. What I hope most is that the book helps them feel connected to themselves deeply, to things in themselves they've forgotten or denied or repressed or have been pushed away. The book, I hope, does that for them. I hope it helps people heal as they're reading it. They can find it, I think it's pre-ordered. I don't know when this show is going to be aired, but right now it's pre-ordered. The book comes out in June 24th. It's called Truth Medicine. Truth Medicine. Yeah. You can get it on all the platforms. You get the books, Barnes & Noble and Amazon and my publishers. You can find me at michaelsapiro.com. I have a community there, a community page where we can interact together and you can join in meditations. Instagram, Dr. Mike Boise. A lot of poems on there. I spend a lot of time working and giving, so I don't really build up the platform too much, but people can get a hold of me through Instagram or on my website or just join in that community. Dope. Love it. Yeah, my followers are very engaged. They always have follow-up questions. They love to connect. I would love that. I would love to answer that stuff. And, we're giving a small window into a huge part of my career, and I would love to have it filmed and then people could see it in real time. And that's what I do with my students. I have them come in and we do it with each other.
they watch me doing it. They can ask questions, and it's a very fluid process. It's different every single person who comes in because you're greeting someone's heart, and it's fresh each time. So it's fascinating stuff, man.
Hell yeah. Well, again, super important work. The last question that gets asked everybody on the show is, what does living a genius life mean to you?
I think everybody has innate potential to do something that's only unique to them, completely unique to their being, to their person, and it's inside them. A genius life looks like waking up to what that is inside of us, expressing it, and living it. Whatever that be, dancing, singing, service-oriented stuff, but it's unique to each one of us. And a genius life looks like living that fully, without apology, fully
Amen.
Authentic. Yeah.
I've always believed that if you're the only person that can do something, then you have to do it.
I think it's tiring, man. Sometimes it's really tiring having that in Dune. It's called what is Paul, the main character? He calls it a terrible. What is it? The terrible purpose.
Ooh.
That's what it feels like when we feel and sense our gifts. It like drives us, and we can't even stop when we want to. So our job is to have to balance, to go, hold on, I need a little break, because finding that terrible purpose is what we're meant to do. And I think everyone listening has that within them. That's my job, is to help them access what's authentic just to them, and then helping them do that, pushing them into doing that. Go live, you know?
So now I have an additional question. What's your terrible purpose?
I think it's waking people up to how beautiful each one of us is and how precious our life is, and then living it fully. I am driven to helping people live their lives fully, who they're meant to be, not who they're told to be. That's my purpose. And whether it's a firefighter or you or anyone listening, it's like, who are you meant to be? And can I help you get there? And to drop all the guards and all the defenses and live your life truly authentically. I think it's part of my drive.
It's an incredible gift. Yeah. I feel very lucky that at least I have the sense that I've identified my terrible purpose. And I get to live that every day thanks to my wonderful, my listeners, my viewers. I'm very grateful. Well, thank you, Dr. Sapiro.
Thank you so much for having me. It's been awesome being here with you in person and kind of digging in.
Yeah, of course, brother. Pick up the book, Truth Medicine, guys. And thanks for listening. Share this episode around with people who may benefit from it in your life, friends, loved ones, and I will catch you on the next episode. Thanks, everybody. Hey, if you liked that video, you need to check out this one here, and I'll see you there.